Welcome to the Balance to Excellence podcast. I am Dr. Judy Wright. Please like, comment, share, and subscribe. Now let's get right into it. One thing about change, it's going to happen. You can count on it. Change happens every day, and no 2 days are exactly alike. Change is not going to ask you for permission either. You can roll with the punches or get run over. When you understand that dynamic, the concept of pivoting, if and when necessary, starts to make more sense. Simply put, pivoting is about making a change in direction, a change in strategy, or a change in a goal that you were working toward or may have even achieved. It may not make sense to those around you, but because the circumstances have changed, how you feel about it has changed, opportunities have changed, you make a change in direction in response to it. This is a passage from my book, Girl, Get Your Life Off the Fault Line: The Busy Professional's Guide for Mastering Balance to Shift from Overwhelmed to Empowered. And I wasn't sure if I was going to have this conversation, especially so early in the game of this podcast, because I wasn't sure how it would be received on a podcast where we talk about being able to find balance for healthcare professionals and mostly, hopefully, that it can help you to stay in the profession you love. But I saw a YouTube the other day and it really touched something in me. It reminded me of what I dealt with. And I thought it was necessary to bring it because, again, change is happening. Who you were 10 years ago is not necessarily who you are now. And it may lead to change in you. It may require change of you. It may lead to change in you. And I think that when people talk about pivoting, you know, there's two camps. There's some people who are like, yeah, pivoting is a good thing. And there are some people who may see pivoting as quitting. So I really wanted to talk a little bit more about that and give you 5 tips if you're looking to pivot and deciding if you are going to pivot or not, right? So let's talk about this for a bit. So I was watching a YouTube video, and the name of the channel is Gooby and Doobie. So Gooby and Doobie was the name of the channel. I have no idea. I watch a lot of YouTube, guys. I have no idea how this even ended up in my algorithm, but I gotta tell you, I was glad that it did. Um, because I watched the video twice. And the person who was speaking in the video, I think he calls himself Gooby, um, is a physician. And I, again, you would think because I'm a physician, that must mean that maybe I'm watching a bunch of physician videos or videos about other medical professionals. I really don't. I don't. um, but this ended up in my algorithm, and I guess maybe we could say the fates wanted it as such. So I wrote down a few things because I wanted to remember um, what this was about. Right? Okay, so Gooby, as I said before, is a physician, but he's not just any physician. He is an MIT, that's what I said, MIT educated neurosurgeon by trade. So we all know MIT is top level, right? Um, Top of the top, best of the best. He did very well. Gooby's also an MIT educated neurosurgeon who is now unemployed. Now, when you hear that, you may think, well, what did he do to get fired? Right? Gooby did not get fired. Gooby resigned. Gooby left. Um, and Gooby had his reasons for it. So one of the things that he talked about, and I really want to not miss it because I'm not going to go too much into it because I actually think for any medical professional out there, definitely physicians, but for any medical professional out there, I think the video moves kind of slow. He's very calm. He's out in nature. It's peaceful. And it moves kind of slow, but I think it's so relevant what he is talking about. And I'm going to call him Dr. Gooby. Dr. Gooby is basically trying to explain why he opted to leave, not the hospital. He left the profession. He left the profession of medicine. Um, and I want to give a disclaimer that this episode is not about leaving the profession of medicine. That's really not what it's about. It's really about, if you hear that, I don't know if you can hear it, but we have some thunder outside. But it's really about him making a change that he felt was absolutely necessary for him to make and what that looked like, right? So, what he really talked about is that when he was in medical school, one of the things that he remembers, I don't know if it was a doctor or a professor, said to all of the students was, your job as a doctor is to relieve suffering. Now, that relief could come in the form of medication, it could come in the form of surgery or a procedure, it could come in the form of just listening to the patient and their needs, forming a rapport with the patient, right? That could be the way you relieve suffering. And so he heard that and it stuck with him. And so he trained, he did all of the things that he needed to do, went through his 4 years of his 4 years of college and 4 years of medical school and residency and even a fellowship. He did all of the things and all of that extended training. So we all know, a lot of people don't know, but we all know that becoming a doctor did not start in medical school. It did not even start in college for most people. For most people, becoming a doctor started even earlier than that. I know for myself, I knew around the age of 8 I wanted to be a doctor. And around the age of 14, I started doing the things to gear toward that. Okay? Volunteering in hospitals, working in different sectors of the hospitals during the summer, um, doing things in college. So this started even before that. So when we talk about the time and effort you put into becoming a doctor, for many of us, that's not the 4 years of medical school and however many years of residency and even a fellowship. So, you know, that could look like 4 years of medical school, 4 years of residency, and a fellowship. That could easily look like 10 years, maybe even 12. No. There's all the pre-med stuff you did before that. There may have been stuff you did in high school before that to even get you into a college with a pre-med program. It's a lot, right? So he did all this extended training. He got paid well. He had great colleagues, he said, good support. He was well respected. But what he wasn't was happy. And at first, he couldn't even describe why he wasn't happy. Yeah, yeah, he couldn't describe it. But eventually, he was able to describe it. And while I won't go into much detail, what I got from what he said is that once he entered medicine, once he was taking care of his patients, which he enjoyed taking care of his patients. He wasn't sure exactly what role he played in helping to make his patients better. He saw he really started to pay attention, because when you do surgery, especially when you're doing neurosurgery or you're doing orthopedic surgery, the hope, let's say an orthopedic surgeon, they do surgery on the knees, um, because someone has bad arthritis and they may need a total knee replacement. You go and do a surgery with the hope that it's going to make it better, right? And you can do a perfect surgery. And here's the thing, it might make it better, it might stay the same. There's a percentage that might actually feel worse. That's, we, all the physicians learned that. That's just, it is what it is, right? And so Dr. Gooby really talked about also looking at the difference in his patients and the ones that did well and the ones that didn't do well, right? And the things that the differences in the way they managed themselves and how that lent to that. And so he really started to question some things, and it really led him to really, what I got from it was there was a bit of disillusionment with the medical system, for him. And he was, he said it multiple times. It wasn't about the hospital, it wasn't about his colleagues, his patients. Just for him, he wasn't sure how what he was doing helped his patients. And so he made a decision. And because he was unhappy, he felt the need to make a decision. And his decision was that he was going to leave. And he didn't leave right away. He gave them almost a year, extra year, letting them know this is what he was going to do. But he gave them almost an extra year. He told them the time frame. And when that time came, and he did it so that they could have time to search. The question I had, because I've seen this often, is, did they believe him? Did they actually take the time to search? Did they think he would change his mind? He never really answered that question. Because I asked that question because I'm sure, and he did mention that, but I'm sure a lot of people did not understand why he was doing what he was doing. I mean, he was well paid, he was well respected, he liked his colleagues, he liked his patients. What's the problem? Right? That's how I'm sure people felt and people asked. And he gave them, sometimes he gave them some answers, but they don't always understand the thought process. How could you be a successful? And I will say this: I think a lot of people go through. I think if you're in corporate, do you all remember there was a time when Dave Chappelle had the Dave Chappelle show? Now I wasn't watching Dave Chappelle at that time, but Dave Chappelle had the Dave Chappelle show, and then uh, uh, the way I've always heard the story was when it was supposed to come back for another season, he was offered somewhere around $50 million. That's the way I always heard the story, and he didn't take it. He didn't take it, and he ended the show. The show ended, and I can tell you for a fact that I heard a lot of people talking about how he cracked under the pressure. And I'm talking about the people that I knew. He cracked under the pressure. How do you give a $50 million? What's wrong with him? Oh, that's a weak move, right? Like he, and do I really know why? If Dave Chappelle spoke about it, I don't know. But do I really know why Dave Chappelle didn't take it? No. But sometimes you don't know. Some people, they love something that they do until there's a lot of things around it that wasn't why they got into that particular profession in the first place. Maybe they did it for the joy, right? And everybody's looking at but the money should give you the joy, but the respect should give you the joy, but the height that you're at should give you the joy. And sometimes it doesn't. There's so many other factors that go into it. So I'm going to tell you my story a bit because I think that's why I ended up watching this twice because it resonated with me. So, like I said, I knew at 8 years old. I was that kid. I liked going to the doctor. I liked being. The nurses. I was that kid, and so I knew at 8 years old I wanted to be a doctor. And one of the people that I really looked up to, I looked up to all of them. I really did look up to doctors, nurses. I looked up to all of the medical staff. But one of the people I really looked up to is my own family physician. Now, at the time, I didn't think I was going to be a family physician. I thought I was going to be a pediatrician, but yeah, changed that. So, um, I looked up to my family physician, and I I looked up to him because he was able to take care of my entire family, and he was personable, and he really built that relationship with us. And his waiting room was always filled. Okay, I'm not even gonna lie. My family physician is named Dr. Booten. Dr. Booten was late most of the time, right? But for the most part, no one ever left. And there's a number of reasons that he was, late. He had another practice somewhere else, but he also saw patients at the hospital, So, and as you could that in itself can cause you to be late. And we won't even talk about New York traffic, right? So, he was always late. But the thing about him is he would stay as late as he had to see all of those patients, and no matter if you were annoyed because he was late by the time you went in to see Dr. Booten, by the time you went in to see him and you came out, you didn't feel like that anymore. So, and I really looked up to him. So I wanted to be a doctor like that. I wanted to be a doctor that helped the community. I wanted to be a doctor that understood the community, because that's another thing, that I came from a community that was mostly of color, mostly black, mostly Caribbean too. And he also was from the Caribbean. And so I think that also helped to build a trust factor. I wanted to be that type of community doctor, really there for the community, to build with the community, to give back to the community. And so I did everything I did. I was they used to call them candy striper back in the day, but I was a volunteer at the hospital at age 14. I did that for a couple of years. I worked summer program in different parts of the hospital, medical records, even the kitchen, just to be in proximity. I went to school. I became pre-med. I, went to medical school. I then went through residency, and I did all of that, right? And then I became an attending. Then I now can get my own panel of patients, which I had a panel of patients in residency, but now no one's really supervising me. I am the doctor. And I could tell you, within 2 years of finishing residency, I knew. I knew I wasn't gonna be a physician that was going to last 30 years, 20 years, maybe not even 10. I knew. And the reason I knew is because what I had envisioned, that's not what was. What I had envisioned about being a physician, that's not what was. And it's not that I didn't want to do all the work. That's not it. I wanted to do the work. And I wanted to do for my patients. And I felt held back a bit. Lots of red tape that you had to go through. And it wasn't just insurance, it was administration, just lots of red tape, just to try to give my patients the care I felt they needed and deserved. And I really built a rapport with my patients. I loved working with my patients. Were there hard days and very difficult patients? Yeah, there were. But I loved working with my patients, and I loved supporting them, and I loved understanding their story. I loved understanding their story. Um I remember stories to this day, even though I have not engaged in direct patient care in years now. But it's the fact that I couldn't practice medicine, or I felt that I couldn't practice medicine the way I want to, that made me unhappy, and it made me not feel satisfied um, with, you know, giving that care. Because it's not giving the care that I felt was necessary to give. And so I felt a bit disillusioned. And I felt like if I couldn't give the care that was necessary to give, if what I knew as a child, as an 8-year old, as a teenager, as somebody in college who was pre-med, if that all had changed and this all changed, what was I going to do? Was I just going to stay unhappy with it? And so I kind of knew, like I said, that it wasn't going to last for way long. But I stayed. I stayed for years after that, because I still wanted to give my patients care. And I can tell you that at the 10-year mark, actually the 10-year mark from finishing medical school, I was no longer engaged in direct patient care. I made a pivot, but I will tell you this: I didn't want to completely pivot away from what from being a physician, from being a doctor. And I did the research before I made that decision. And so, I think that was very important. And I think what Dr. Gooby did for himself is what he felt was necessary. I do believe he said that that may have been almost a year ago. And when he left, he didn't know what he was going to do, but he knew he had to leave. And he feels he's married. He feels this is the happiest he has ever been. So, again, I want to say this is not about leaving medicine. This is more about pivoting because I don't consider that I left medicine. I left direct patient care, but I don't consider that I left medicine because I now work within managed care, helping to make decisions to, basically get people the care that they need, get people the things that they need to live a better quality of life and safer out in the community. Yeah. And so I look at it as being able to take the knowledge that I have and extended it more to a bigger population than I was able to do in the clinic setting in which I was working. And so I think that when you feel change happening, like I said when I read that passage from my book, change is going to happen regardless. And you can roll with it or you can get run over. Sometimes rolling with it means that you have to change a bit too. It could be a small change, it could be a big change, like a full out pivot, right? And what I want to impart is don't be afraid of change. Don't be afraid of change, right? Don't be afraid to pivot if you have to either. You might pivot and your pivot may be something as simple as, you know, I was a hospitalist and I was seeing patients in the office. Now I want to shift to just seeing patients in the office, or now I want to sell my practice and I want to just be a hospitalist. That in itself is a pivot. You have your own reasons for doing it, and it may be around getting, it may or may not be around getting more structure around your life, finding more time back for yourself, and all of the things you want to do, finding more balance. So this was more extended, but this is what I wanted to get across. So there's five things when you are thinking about having to make a change and possibly even pivoting, because again, don't be afraid of a pivot. A pivot can be big or small, and sometimes it doesn't even take a pivot, sometimes it takes a tweak, but we'll get into that. There's five things that you can do, so let's go over that. The first thing is to know yourself, right? Know yourself, know what you're feeling, um know the situation at hand, and understand how you're feeling, and are you really feeling like you need to make a change, right? Are you really feeling like you need to make a change? Assess the situation is number 2. Assess the situation at hand. So this is going to be, again, you being more aware. Why do you feel this way? What's causing this feeling? Why are you thinking that way? And how long have you felt that way? Is this feeling constant, or do certain things bring it on? Like, you know, is it something you can't seem to shake, or is it when something really, ticks you off? And even if it's when something ticks you off, then you have to think to yourself, how often is something ticking you off? Because if you're getting ticked off every day because of something that's happening at work, it really may be because you feel the need to change, right? And this is a big one because this is the one that Dr. Gooby goes into um, with regards of his own situation. Is it serving you or is it harming you? Is staying in the situation serving you or is it harming you? Or is it doing both, but one is winning out, right? So, number one was know yourself, and number two was assess the situation at hand, right? Because again, if it's a situation that you are having, it's important to understand, is this because the landscape has changed, or is this because you're just not handling situations optimally? Because if it's that you're not handling situations optimally, you leave this particular situation and go into another, you're still not going to handle it optimally because anywhere you go, there you are, right? So really, work, take the time to work through that because it's worth it. Like I said, I knew 2 years in, and I probably stayed another somewhere between 5 and 7 years. I probably stayed. Um, and so number three is clarify your vision. What is it that you really want? Where do you think you can get it? What do you want it to look like? For me, I knew I was leaving patient care. That was the vision. I knew I was going to end up leaving direct patient care. That was the vision. For Dr. Gooby, he left medicine, right? So clarify what the vision entails, what it looks like. Really start to visualize what do you want. And in order for me to clarify my vision, I had to do the research. So like once I realized what I start to get a sense of what I want to do, I then was, I'm not even gonna lie, scared because I was like, wait a minute, I put in all this time. I don't want my degree to go to waste, which is what keeps a lot of people in. Um, and there's nothing wrong with that. It really isn't. But for me, it automatically made me say, let me do my research. And so I did. And even the research helped me to further clarify the vision of what I wanted it to look like because I still wanted to help people who needed health care. I still wanted to do that. Number four, seek support and advice. And let me just say this. That's a hard one because I know it's a hard one because again, people, especially if you're very successful in what you do, people are going to be like, they're going to ask questions like, why? What's the problem? They're going to come right out and say, so you put all that time in to leave? People are going to say, because they don't necessarily understand us. They don't necessarily understand us or understand how we think, how health professionals think. And they certainly are not going to understand how you could be in a profession that is respected, that's stable, that you had to put in many years to be in, that you make good money because trust me, they believe all of us is making $1 million. um, and if you know, you know. Um, but people are going to question, and some people are going to look at you crazy. However, there is support out there, and please understand that because anybody can do a pivot, your support could be in the form of another healthcare person who may have gone through this, or someone that is a healthcare person that you trust and that's not going to judge you. But it could be somebody else. It could be somebody in corporate that was in corporate that pivoted. It could be you can find your mentors anywhere, your support anywhere. You can get that advice from somebody that not only did it but did it successfully, right? And success looks different for everybody. As I listened to Dr. Gooby, he did it. He's still not even working and he's happy. And I think that's success, right? So, um, that's number four, seek support and advice. Don't just jump ship. Jump ship with a plan, even if the plan is, I'm not going to do anything right now. Have a plan and understand your plan. And number five, the last one is don't limit the pivot. What do I mean by this? Sometimes you find yourself pivoting more than once, and some people feel bad about it because they don't want to look wishy washy. That doesn't make you wishy washy. That makes you really defined about finding something that works for you. That's what that's about. That's what that's about. Why would you pivot from something that wasn't working for you into something else and just stay if it's not working for you just because you don't want to look wishy washy? That doesn't make any sense. I can tell you when that as I was making my exit from direct patient care, it kind of looked like this. It was I left one position, went to another one, um, that was still direct patient care but part time, and then went to another one after 2 months that was direct patient care but part time. Stayed at that one for 8 months, and then I got an offer for another position that took me out of direct patient care. And so, in under a year, I had changed jobs 3 times until I found what worked for me. So, don't limit your pivot because you're afraid of looking wishy washy. Don't do that, right? If pivoting is what you decided to do, if you decided that it's not just a little tweak that you need to make, because that's possible, that maybe it's just a little tweak. But if you decided that you want to pivot, understand, don't limit it, don't be scared of it, because you can always pivot to something else. If you pivoted 3 years ago and it didn't work out, you could always pivot to something else. Even if it did work out, you could pivot to add something, take away something. So it's all good. So those are the 5 tips would that I wanted to impart to you about how to pivot to make a change that works for you. And again, because I'm going to say it one more time, this is not about leaving medicine. That is not what I'm saying to you. And I don't believe that's what Dr. Gooby was saying or trying to encourage anybody else to do for themselves. He was just talking about what he did and why he did it and why he is a high level, highly trained neurosurgeon who no longer is working as a neurosurgeon. So, with that said, if you stayed this long, okay, um, I appreciate it. And like, comment, share, subscribe. I am Dr. Judy Wright, and I am a physician, as you well know by now, and I'm a performance strategist. And what I do is I help medical professionals perform at a higher level, right? No matter what they do. And the performing at a high level is not just the profession, which is important, but also in their everyday lives. Again, this is the Balance to Excellence podcast. And I am so glad that you chose to be here. And we will talk again next time. Bye.